Good morning to everyone, and thank you for joining us today for our annual award celebrations for those folks who are doing just a terrific job across campus at innovation and discovering and promoting entrepreneurship across our campus and across the community. This is always a day that we look very excited, I look very forward to and excited about, because it's a time for us to be able to say thank you to you folks as students, as faculty members, as researchers, as staff members, who really do put a lot of effort into discoveries and innovations and promoting entrepreneurship in a way that impacts our UAB community, the Birmingham community, the state and beyond. So we really do appreciate that, and think this is a great way and a great day to say thank you to all of you folks. Now, because we are obviously still in the midst of this pandemic, we're not doing our event the way we would really like to do it in pomp and circumstance, but rather we're going to do it via Zoom, which we've all gotten very familiar with by now. So again, thanks for joining us today. As we start, before we actually introduce the awardees and the inventors, so just want to take a few minutes to talk a little bit about the Institute for Innovation and the Harbert Institute for Innovation and Entrepreneurship. As most of you guys know, this is our tech transfer office. It's the commercialization arm that represents all of UAB, and as well as the healthcare system as well. So our mission is to translate ideals to impact, to innovate, and to really do everything that we can to promote a culture of entrepreneurship across our campus and in the community as well. So in terms of our metrics, next slide, Brianna. I just wanted, we operate by the fiscal year. So the fiscal year for 2020 has just ended. I wanted to share what our metrics are with you. Some of you may have seen this in Dr. Watts' State of the University address. This is something that we're pretty proud of. Even during the time of working remotely from home, I feel that our faculty and researchers and students really did do a really tremendous job, as did our staff within the HIIE. So I wanted to just take a moment to share these numbers with you. In 2020, we had 83 disclosures of intellectual property. The revenue generated by our technologies in 2020 was 4.52 million, which we think was very, very good, given the fact that companies did struggle, companies missed milestones, those kinds of things this year. So we're very happy with that number. And I would like to say too that the Research Foundation, the Institute for Innovation and Entrepreneurship, still operate in the black. We're one of the very few tech transfer offices across the country who actually operate in the black and have a positive balance at the end of the year. So it's something that we're proud of too. We had 16 patents issued in the United States. Many of you might know that, one of the things that we've been really working on is our SBIR and STTR funding. In the 2020 year, we had $414,000 awarded from SBIRs and STTR grants. 40 licenses executed, and we interacted with probably over 200 inventors across campus. So these are just some of the metrics that we're very proud of. We're working on really finalizing out our 2020 report with an impact report that we will be sharing more broadly with you guys in the near future. If you look at what we, are doing in terms of, not just being reactive, but really thinking about building our ecosystem and really focusing on economic development in our local community in Birmingham. If you look at the companies that we have produced over the last several years, They account for 700 jobs that have been created and maintained. We have 27 local startups that are currently working in the Birmingham area, 9 states where we have startups working, and we have startups working in 2 different companies. If you look at the combination of the value from the startup companies over the last 10 years, the valuation is $4.5 billion. So you can see that, you know, the work that we do here in terms of promoting innovation and entrepreneurship, it really does add and impact economic development in our community. And this is what we are going to continue to do as we go forward. So, you know, when we sat back and thought about what do we want to do this year in terms of the Innovation Awards, we thought, well, you know, it was so apparent so immediately that so many of our researchers and faculty were working on day one things to, you know, impact the coronavirus and the global pandemic that ensued in at the beginning of this year. And, you know, it's no secret we've had UAB spokespeople, our immunologists, our infectious disease physicians, our clinicians, our frontline workers who have been treating patients here in the hospital, our UAB leadership in terms of protecting faculty and students and getting us all back to work. It's just been a phenomenal team effort, and I'm really proud of all of us and happy to be part of this great institution. So we thought that it would be appropriate to really highlight and honor those folks who have been working on on innovations related to COVID-19. So all of our awards today are focused on that. Next slide, Brianna. So this year, when we put out the call for nominees and for recommendations, we really had just an outpouring of nominations. And I wanted to just put this list of nominees up here so that you could see how many different people were recognized. So I want you to know, if your names are up here, you are obviously greatly appreciated by UAB and the people who have nominated you, and your work definitely has been recognized and is very much so appreciated. So I want to congratulate all of you and thank you again for the hard work that you've been doing. So the first award that we're going to talk about today is the UAB Startup of the Year. UAB Startup of the Year goes to Solution Studios, and Solution Studios and Joel Berry are, you know, 2 names that I think on campus everyone should be very familiar with. Solution Studio is a platform that was developed to put students together with clinicians to solve clinical problems. And that platform has just been so successful and so popular across campus that we actually launched that as a startup this year. So Solution Studios was counted as one of our startups this year. Joel Berry, I know most of you know him. He's an associate professor in the Department of Biomedical Engineering. But one of the things that he was able to do is quickly pivot and put together a platform, a part of his technology for Solution Studios, to specifically address COVID-19 related issues, clinical issues that came up, connecting. It allowed the clinicians at the front lines to just very quickly say, here are issues, here are our problems, and we put together a community of people to help tackle those issues. Things like what happens when patients go home, caregiving at home, treatments like dialysis, how to put an iPad in a room and be able to use it. So just a whole slew of clinical issues that came up that Solution Studio platform was able to address. So I want to turn it over now to Dr. Berry just to talk for a few minutes about his experience with Solution Studio this year, specifically as it related to the pandemic. So, Joel.
Thanks very much, Kathy. It's just wow. um, so yeah, it's just as far as Solution Studios goes, it's just I saw a need and there was an opening and I took it, it is just it has taken off in not only at UAB and at other universities with COVID issues, but actually, it was with Kathy's help and Saksham's help that we put together this team of physicians to prioritize COVID problems. And we now even still have teams of students working on them. So it's been really successful in that way. And we're waiting for output, and we're fully expecting there will be some really good solutions to these problems. I do want to take a step back for a minute and I feel a bit guilty taking any credit for this, because it took a village of people, starting with my co-inventors, Nancy Wingo and Kristen Knowles. But I just could not have done this without the help of HIIE. Just Shonda, Amanda, Saksham, Karthik, Sat, Kathy, I would have to say that the biggest champion of all was Ray Watts, who supported this, and Kathy and Dr. Watts were just amazingly supportive of this. So, so where we are is that we have signed the license agreement, and we are out working on version 2, adding beta testers. We've added 8 new universities. We have one that's a paying customer now, Texas A&M, which is awesome. And I'm talking to well, so I'm also pivoting to become an entrepreneur, which is way different than being a scientist, but it's a whole lot of fun and very exciting. It's just, it's incredible. So I think that, that to really get stuff done, if you have a community of committed citizens and business people, that you can move mountains. And so I think that's what enabled me to get this done, and I can't thank you all enough. So so really that's it.
So thank you, Joel. And we really look forward to seeing. I mean, we've seen so many great things come out of Solution Studio, and we know that many great things are going to continue to evolve there. And we really look forward to seeing and hearing about all of the crazy, milestones, great milestones that you're going to be reaching. So thank you, and thank you for your contribution, and thank you for you with your team of really staying with this. I mean, Joel, you have really stayed with this, and that's what it takes. Believe in something, and not hearing the words no, and learning how to get over those hurdles and move something forward. You and the rest of your team just did a fantastic job at that. So thanks for that, and we look forward to seeing more from you. So the next award we'll focus on is the Community Innovator of the Year. Our Community Innovator of the Year this year goes to Motion Mobs. Motion Mobs is a Birmingham-based software consulting and developing firm. Together with UAB and the Alabama Department of Public Health, Motion Mobs developed a secure, anonymous contact tracing app called GuySafe, which we've all heard by now. It's a multi-tool platform comprised of GuideSafe, the health check, the exposure notification application, and the event passport that we should all be very familiar with. This app has been downloaded by more than 70,000 residents across the state of Alabama. And, one of the things that I'm proud of and like to really promote is that Alabama was the 4th state to launch such an app in the US. I just think that that's remarkable, and it shows you how quickly and how fast we were on top of this. So representing Motion Mobs today is Emily Hart, who's the Chief Operating Officer of Motion Mobs. So Emily, I'm going to turn it over to you just to say a few words about Motion Mobs.
Kathy, thank you so much. This is such an honor. And really being able to be involved with the GuideSafe application for exposure notification has been such an incredible opportunity. Motion Moms is a small woman-owned business. We're here in the South, and the opportunity for us to play such a key role in an incredible piece of technology that is literally saving lives is a once-in-a-lifetime opportunity. And, you know, when COVID first started coming to the US, we were watching as the disease started to spread, and for a little while felt kind of helpless. You know, we're not doctors, we're not healthcare, we're technologists. And we were really curious as to, is there anything that we can do to contribute to this national and this global fight against COVID-19? And as a group of both developers and consumers of technology, privacy is always at the forefront of every project that we work on. And as we saw other countries start to develop their own technology solutions to the challenges of contact tracing, they made us a little twitchy. And so in May, when Google and Apple announced their actual GAIN technology, Google Apple Exposure Notification, it was right in line with our firm's belief that user data privacy should always be guaranteed, even in a global pandemic. And so we had such an incredible experience working directly with the UAB team, with Dr. Kirk Carver, with Brian Rivers. Thank you so much for your support throughout this process of building out GuideSafe exposure notification. And, you know, we had incredible support from the Alabama Department of Public Health, have to verify those diagnoses through them. And so we've just been so thrilled to see the success of this application after it's been launched. And post-launch, we've also had the opportunity to get some amazing support from EDPA and their Reignite Alabama pitch competition that empowered us to be able to have these conversations with other states, other public health authorities. And we've even had the opportunity to share our experience building GuideSafe with the US Department of Health and Human Services, with the Senate Help Committee, with the House and Senate Judiciary Committees. And it's just been such an incredible experience. And we're very proud to be able to carry the name of Birmingham, of Alabama, and UAB as we continue to fight this disease. So thank you so much.
Thank you, Emily, and please pass along our congratulations and thanks to the rest of your Motion Mobs team there. We're happy to have you in Birmingham. Look forward to seeing all the wonderful things that your company is going to do in the future as well. So moving on, next is the UAB Staff Innovator of the Year. And you know, can probably guess the UAB Staff Innovator of the Year goes to Brian Rivers. Brian is Associate VP and Chief Technology Officer. He was the UAB lead in developing the exposure notification app in partnership with Google, with Apple, and with Motion Mobs and the Alabama Department of Public Health. Brian developed a novel method to verify positive tests, allowing automation of verification to reduce false positive tests, which was really important. Alabama was the first state to introduce this method, which, you know, we currently have in the patent process. So Brian, please take a few minutes and say a few words.
Oh, absolutely. And I just want to echo the point that Dr. Berry made earlier. I think my claim to fame here is that I had an opportunity to work with some truly amazing people to accomplish some really amazing things. You know, Emily and her team on the call, Dr. Feldman, Dr. Thermali, these people you'll be introduced to shortly. This was a collaborative effort that really, I think, made a difference for our community. I want to provide one update. The app you mentioned earlier has 70,000 downloads. As of today, it's around 130,000. So the numbers are really growing here in Alabama. And just to make a point, we were the first state to do a large scale pilot deployment, and we missed being the first state by about a week. Virginia jumped our case on it, and you know, it was kind of sad, but you know, the important part was that Alabama was able to get access to this very early. The verification method that we invented, I think, made a very big difference for us. One of the things that the Department of Health said, who've been great supporters and great collaborators in this, that you know, we we can't take on additional burden that's typically imposed by these apps. So we had to put our heads together and design a privacy preserving method. It's very simple for people to use. They provide their phone number, they get an SMS text, and that text basically allows them to verify their positive test. And we've collaborated with several other states that we're working to release our method to them to be able to solve their problems as well, because a lot of other states out there are dealing with these issues right now. So just really impressed with the work that the team has done, and really pleased to see that this has been taken seriously by UAB. The thing that I think is the most amazing thing to me throughout this whole process was the support from the university and its leadership. Other states, as they were scrambling to figure out how to even develop an app, UAB jumped to the forefront and said, we will do this for the state of Alabama and to protect Alabamians. And we locked hands with the Department of Health and the CDC and Apple and Google, and we did this with very, very little impediment. And that leadership support, the support from the staff, I've never been anywhere else where I think this could have happened. So very, very grateful to be part of UAB and part of this. Thank you.
I could not have said that better myself, Brian. I think that's absolutely true. I think we all at UAB have something to be proud of in that. So thank you, Ryan. And thanks, please convey thanks to the rest of your team as well. So moving on to Faculty Innovator of the Year. The first Faculty Innovator of the Year that we want to highlight is Dr. Sexto Leal. Dr. Leal directs the UAB Department of Pathology Fungal Reference Lab. He has been working closely with UAB hospital labs and the private sector biomedical companies to scale up and to support the GuideSafe entry testing program. Through that program, COVID-19 testing was provided free of charge for all students in Alabama colleges and universities prior to the fall semester return to campus. And, I think we would all agree that was a big part of, keeping us safe and allowing the schools to open early on. And the numbers may have gone up with this, but at the time we got the numbers, more than 75,000 students were tested, making it the largest scale higher education testing initiative in the nation. So we're also very, very pleased for this. So many thanks to Dr. Leal and his team for helping to make it a safer return to campus for all of us across the state. So Dr. Leal, please take a few minutes to say a few words.
Thank you so much for this award. It's an incredible honor. And I just want to echo what others have said. I don't think this really could have happened anywhere else other than UAB. The way the community came together, in the hospital and the research setting within our laboratory just to make this happen is incredible. So in March, we developed the first diagnostic test for SARS-CoV-2 here at UAB and implemented early enough to enable hospital and research operations to resume. FDA study ultimately identified our assay as the most sensitive in the nation, which made it really ideal for pooling. At the time, we weren't thinking about pooling, but with the Testing for Alabama initiative that then became the GuideSafe initiative, there was a need to test 250,000 students prior to return to campus. And the test we developed was perfect for it. So we had the idea to develop the pooling innovation. And with this, we thought that there would be about a 1.5% positivity rate. And if we were to pool 8 samples together, we could test one sample and get 4 results. Ultimately in real life, we had a 0.75% positivity rate. That allowed 5 results for each test that we performed. So that allowed us to expand the numbers greatly. So we went from 150 tests per day in March to up to 11,000 tests reported in a single day during what we call the surge of the GuideSafe initiative, when all students were going back to campus. So it was a quite incredible effort, quite incredible feat. To do this, we recruited over 20 talented individuals from the UAB and the Southern Research Institute community. These individuals had incredible molecular biology skill sets and really stepped up and contributed significantly. I'm incredibly grateful to them for doing so. Over a 4-week span, we obtained equipment, reagents, trained, validated, implemented this system. The surge lasted about a month, and like I said, we resulted 11,000 results in one day. We really feel grateful and proud that we were able to help implement a safe return to college campuses. And yeah, the infrastructure that we built was not just used for that. We continue to use it now for campus sentinel testing and community testing. And it's just been an incredible, I wouldn't say roller coaster, but it's been quite a journey, and a lot of input from a lot of people that have really stepped up. And it's quite a beautiful story that I'm really happy to be a part of. There's a lot of people to thank, and I'd like to thank, the university leadership at the very top, Ray Watts and Dr. Vickers, that saw the vision and the need within the Department of Pathology, and Dr. Neto and Marissa Marquez. Thank you for their leadership. A colleague, molecular pathologist, that we couldn't do this without, Craig McKinnon and Shuko Harada, and also hospital labs, Sherry Polhill, Jordan DeMoss, Diane Hendricks, the entire GuideSafe team, which is a large group of individuals. Individuals within our lab, particularly Drew Freeman, Jeremy Meter, and Thomas Stechemendy, stepped up to lead the effort within our laboratory, and all the recruits into the laboratory as well. With that, thank you very much for this award. I'm incredibly grateful and honored, and I appreciate it.
Thank you, Dr. Leon. Thank you for that. Moving on to the next two faculty innovators of the year are Dr. Sue Feldman and Dr. Mohan Thirmalia. Dr. Feldman is a professor in the School of Health Professions, senior scientist in the Informatics Institute, and director of graduate programs in health informatics. Dr. Thirmalia is assistant professor in the School of Health Professions Department of Health Services Administration and Health Informatics, and Director of Information and Communication Technologies for the UAB Lakeshore Collaborative. Their teams work tireless to build and scale, and I can tell you this for sure because I talked to Sue and Mohan on many days where they had been on Zoom or on the call for 12, 15-hour days at a time. When they were scaling up what started as the Health Beat COVID-19.org website, GuideSafe, the UAB Health Check, and web applications. And, I think the point to make here is that, along with their team, they really ensured UAB led a leadership role in addressing the COVID-19 pandemic, not just locally, not just in the state, but beyond as well. So there is just no question about it. And, the impact of their work in helping to keep our community safe, helping to keep, faculty and students able to come to school and know when not to come to work, et cetera, it just cannot be underscored. So I know how hard these guys worked. And so I want to personally thank them and, give them a moment to talk about their experience with developing these products. So Dr. Feldman, would you like to go first?
Sure, thank you very much. So I'm honored to be among such great nominees. I think as I'm talking about the GuideSafe journey, you'll hear much of what others have said already. Incredible support and lots of help from others. So GuideSafe at the core was a series of, yes, we can do that. Yes, we can get it done, and just plain yes. Answers to sometimes seemingly ambiguous questions. It all started with a phone call from Dr. Sarah Parkak from the College of Arts and Sciences. I still have never met her, but anyways, she was telling me about her idea to develop a crowdsourced COVID-19 survey specific to Alabama, and wanted to know if that can be done. And I said, well, sure, anything can be done. So I ended that call, and then I called Dr. Mohan Thirmalia, my colleague in health informatics here in Health Services Administration, and he said yes. And so with early support from every single senior administrator across campus and the School of Health Professions Dean, Dr. Andrew Butler, these yeses resulted in helpbeatcovid19.org. That's a web-based survey for collection and visualization of COVID-19 symptoms and emerging hotspots. which went live on March 22nd, which was just a week after, 8 days after Dr. Parkak and I had first spoke. In between that first yes on March 14th and the go live on March 22nd, there were multiple flurries of yeses from senior leadership across campus that made this happen. Ultimate collaboration and no barriers kind of fits with innovation, I think. So that was March 22nd. By April 1st, just more than a week later, I was contacted by Dr. Selwyn Vickers asking if Help Beat COVID-19 could be repurposed for to be used by UAB for re-entry. I'm not even sure if I understood what re-entry meant at that time, but of course I said, yes, we can do that. Quite frankly, I don't think we really knew what he was even talking about, but sure enough, we said yes. By about mid-April, just a month after that first call from Dr. Parkak, Dr. Vickers had me and Dr. Thromalai presenting what was then Stay Safe Together and has now become Guide Safe to the University of Alabama System Board. Because when he asked if this was something that could be used for the UA system, of course we said, sure, it can be. So at that point, our seemingly simple project had become one of high stakes. All the while, we just kept saying yes. While we were getting geared up for the UA system use, Dr. Vickers came back and asked if our solution was scalable for the entire state. To this point, we'd been saying yes to everything, so why not say yes to this? And off we went. At that same time, I had a conversation with Dr. Kirk Carver and asked him about his shop developing the exposure notification app. We kicked around several options, including UAB developing our own, when we finally settled on the Google Apple app that you heard about earlier. And we settled on that because of its strict privacy protections. And so after we talked about that, he said yes, and off we went under the terrific leadership of Brian Rivers, who you heard from already. Then about 2 weeks after that, Dr. Thromalai and I had a conversation where I asked about the event passport. With very little hesitant, he said, yes, of course. Then these seemingly individual pieces and parts became what we now know of as GuideSafe, a platform of tools to mitigate the spread of COVID-19. GuideSafe includes Health Check, which we all know about here at UAB, and an event passport and the GuideSafe exposure notification app. Health Check is being used by 33 schools, K-12 and higher ed, public and private in Alabama, with over 250,000 daily users. And as Brian mentioned, the GuideSafe exposure notification app has had around 129,000 downloads across the state, with 266 verified positive tests reported. Through the guidance of Dr. Nugent and Karthik, GuideSafe has also been licensed to Guideway Cares, a local Birmingham company, and through Guideway Cares, we've licensed GuideSafe to several schools outside of Alabama, as well as businesses within Alabama. So as you can see from this brief timeline, GuideSafe was a series of yeses and collaborations from across the UAB enterprise, the UA system in the state of Alabama. Where better to have innovation and collaboration like this than in an institution of learning? And nowhere better than UAB. Only at UAB can this kind of collaboration happen in such a short, compressed period of time. Frankly, I'm proud to be a faculty member amongst people with ideas and talents far grander than what I can think of on my own. While none of this would have happened without Dr. Parkak's original idea, we would never be here today without the tremendous support of UAB from top to bottom and side to side. And with that, I'll hand it over to Dr. Thromalai, who led the development of GuideSafe, Health Check, and the event passport. Thank you.
Thank you, Sue. Wow, you narrated the timeline so well. Yeah, they have recorded it. I really need to go back to it. I don't really have anything new to contribute. So many people have spoken about the GuideSafe platform, but there is a lot of thanks to be reiterated. This would not have happened outside UAB. I just cannot imagine it happening. And actually, as Sue told, the health check and passport are used across 30, 40 universities, multiple schools. UAB provided the most challenging environment as academic medical center. So many schools, we were able to build it for the most complex institution within Alabama. That really made our job so easy. If it is working for UAB, it's going to work for everyone, which was, that's one reason why it can happen only at UAB. There are so many people I need to thank. Surely first goes to Sarah Parkak, who just thought about this idea. It was her spark which led here, and Sue, who invited me to this project. I would not be talking here if not for my team members who all work for the UAB Lakeshore Collaborative. I have a team of programmers, and they are the people who do the job. I am just taking credit for them. There are a lot of, again, specific individuals and phenomenal ways in which they help. Dr. Chris Brown was one of the first champions for this project. Within second day or third day, he started to join our meetings. He believed in it big time. He created a very big advisory panel. Most of the people in the panel were like, I only know them by names. Suddenly, I start to meet with them all. And then within a week or so, as you told, Dr. Vickers started to join. He again dreamt big. He took it to the president, and then Dr. Ray Watts took it to the system and all of it. Dr. Kurt Carver, he offered unrelenting support. He was like, Mohan, whatever you need from my shop, you have it. Just ask me, I will get it to you right away. Dr. Laurie McMahon, the graduate college dean, she has been a big facilitator of this. She takes the messages to everyone. Rosie O'Brien's digital strategy, they play a very critical role in the success of most of the projects we spoke about today. Our dean, Dr. Andy Butler, again, very phenomenal. I'm sure you are all enjoying the daily text messages you are getting right now. First, when we started to text, we didn't have a budget for this. We contacted our dean, and he was like, here, take 25,000, spend it. I know you will eventually get funding for this, get started. That is what is resulted in the daily text messages you are all right now getting. So there is a big, many more people we have to thank, but thank you for everyone, and I'm really honored. Thank you.
Thank you, Mohan. So, and thanks to all of you. And I think, having sat here and listened to all of you talk about, these projects, these innovations, these discoveries, and, I think there's one real theme that comes across, and it's that, UAB really provided the environment and the resources to allow all of this to happen. And that is because we have leadership here who really supports and encourages innovation and entrepreneurship, especially when there are times like this where we've had to really put our best minds together and come up with solutions that will help keep UAB moving forward and staying safe. So I just can't thank all of you enough for being willing to put in the time to make these things happen. Believe me, I know it's hard, when people ask you things and you think, oh my God, can I say yes to that? Is that a yes? Like Sue said, I didn't know what that meant, reentry, but I knew, we had to say yes. I think it's that kind of personality and that kind of motivation that really works here at UAB. And I think we do that really well together. Could not be more proud of all of you, and could not be more proud, as all of you have said, to really be a part of such a great institution where the leadership really makes it possible for us to move forward in these ways. And I look forward to seeing great things from all of you and in your contributions to helping us deal with this pandemic. Again, cannot be underscored. So thank you very, very much. Also, usually we hand out all these nice plaques and gifts and things like that. Of course, we can't do that here, but you will be getting your plaques and your, gifts delivered to you. So we'll be working with you to figure that out. We always want you to be able to display these nicely on your desk and wall and all of that. So we'll be making sure that you get them delivered to you in the near future. Just before we close today, I want to bring up, I want to change the subject just for a moment and talk about talk about for 2021, how can we get more of these innovations in? How can we get more? How can we know more about what you guys are doing out there in discovery and innovations? We started a campaign last year called Invent It, Disclose It, right at the time that the pandemic sort of drove all of us home, but it's something that we're still focused on. We've listened to you guys, and we have really been trying to streamline our processes so that it will make it easier for you to interact with our office in various ways. One of those is to eliminating the paper barrier that comes with disclosing your inventions to our office. So we streamlined that process and have gone all digital for that. So all you basically have to do is put your Blazer ID and in along with the name of your invention. It will take you to a form where there are about 5 steps to follow. So a much, much simpler process for you guys to follow. So we want you to check that out. Amanda Dove, who is our patent manager and compliance officer, is going to put the link to that in the chat box. But another neat thing about that is if you've got multiple disclosures that come along with that, you only have to do this once. So we're hoping that this makes it easier for you guys to disclose to your intellectual property to our office and to keep things moving in our pipeline quickly. So you'll be seeing more about that in the future. If you have any questions about that, please feel free to call anyone in our office. Amanda Dove is the person who manages that process, but of course you can call anyone within our office. So just in closing today, again, I want to say thanks to all of you, for all that you do at UAB. We could not do this without our great faculty, students, staff, and our community supporters. So thank you very much. I hope that you stay safe, and I hope you continue to innovate and give us more things to highlight and to talk about. So looks like we're going to give you a few minutes back of your time. So thank you very much, everyone. Stay safe. Talk to you soon.